Well, good afternoon. Hello and welcome to the first of this week's lunch hour lectures. I'm very pleased to introduce to you Tarani. Tarani Chandola is from the International Centre for Life Course Studies in Society and Health. And he's going to ask the question and tell us all about it today. Who wants to work forever? Thank you very much.
Thank you. Thank you very much, John. I'm very pleased and honored to give this lunch hour lecture here today. As John mentioned, this is part of work that I do with the ESRC Center, ICLS. And I'll be presenting some of the research that I do with this ESRC Center. And I'm also presenting some results from my other colleagues who are over here, Professor James Banks and Dr. Katie Matthews. We both co-wrote a chapter for an encyclopedia recently, and a lot of the material that I'm presenting today is going to form part of that chapter. Unfortunately, I couldn't get a picture of Katie, although I tried very hard. These are the people that are involved in my presentation today. Who's not involved is neither Queen nor the late Freddie Mercury. So those of you who thought that this presentation was going to be about who wants to live forever, well, I'm not going to burst into a rendition of the song, unfortunately, or fortunately for you. Okay, so this is the outline for my talk today. And the very first bit is the background to this question. Now, when I asked my friends, when I told my friends that I was going to be presenting on who wants to work forever, they said, what sort of question is that? I mean, the answer is obviously no. We don't want to work now. Forget about forever. You know, what sort of research do you do? And to a certain extent, they are right. I mean, we have got evidence from surveys of happiness. This is one particular survey. Some of you may know about the Happiness survey. You know, people are asked to respond to survey questions on how happy they're feeling at particular points in the day. And they respond using their smartphone, using an application developed for their smartphones to questions, you know, and the Happiness people came up with this listing of the most and least enjoyable activities to be doing throughout the day. And unfortunately, working and studying is pretty much, you know, not the worst. Being sick is the worst, but if you're working and studying, they say it reduces your happiness by at least 5%. Yeah, so it's much, much worse than doing your finances or doing admin or waiting or queuing. Yeah, so it's much worse than that. Well, because I showed you what's the most unhappy thing to do, I have to show you what people said makes them really happy. And you know, it's being intimate, making love, which requires quite a lot of skill if you're filling in complex survey questions on happiness on your iPhone at the same time. You know, how they did that, maybe that's the subject of another research question, perhaps. Now, this kind of survey results on what makes people happy, that work makes people unhappy, is actually contrary to most of the other literature, which is very well established, which actually says work is good for you. And work is especially good for your health and well-being. So this review over here, which was published in 2006, was, you know, the first really comprehensive review of how work can be good for people's health and well-being. And it was a really important review. It was the basis for Dame Carol Black's Working for a Healthier Tomorrow report, which was highly influential on government policies such as the Footnote and other, you know, policies that inform the Department for Work and Pensions. So they found that there was really strong evidence to say that being in work confers all kinds of health and well-being benefits. It's not just material income, wages type of benefits, although that's really important. So financial security, that's really key, but also access to all kinds of other social and psychosocial benefits, like having paid holidays, having your some sort of income protection or social protection benefits, having a regular pension system being paid into. It's also really important for people's social status, for their personal development, for their social relationships, for their own self-esteem, and also it protects people, being in a good working environment protects people from physical and other kinds of hazards. And here's a very specific example of how working for particular kinds of organizations can confer not just a good income, but also all kinds of health benefits, such as access to smoking cessation services, counseling, physiotherapy, health clubs, discounted childcare, as well as all kinds of financial and training benefits. So here's a few examples listed. If you work for particular kinds of organizations, you get tax relief on buying your bicycles, subsidized computer purchases, lower rates of loans, subsidized commuting travel expenses, and all kinds of training activities. This review also found that it wasn't just being in work was good for people's health and well-being, but also coming back to work. So if you're unemployed and you return back to work, there was an improvement in people's physical and general health and well-being, an improvement in their mental health, and the magnitude of this improvement was of a similar size to the harmful effects of losing a job. So when people become unemployed, their mental well-being goes down, but when they get the job back, when they get a job, they have an improvement in well-being that is similar in size to the decrease predecessing. So if working is good for you, then perhaps working for longer is also good for you. So that really is the basis of my research question. I mean, the idea that from the previous report that work is good for your health and well-being, that means if you're exposed to work for longer, surely that must be good for your health and well-being. So it's a very naive question, I agree. But given that a lot of the evidence generally says, work is good for you, so being exposed to work for a longer time, would that result in greater health and well-being, and greater life expectancy? So that was the basis of this really quite naive question. So the next part I'm going to show you is some of the background on who older workers are in the UK today. So we know that the proportion of older workers in the labor force has been increasing steadily since the 1990s. So on the left-hand sides over there, we see the younger workers, aged 16 to 24 and 25 to 49. And amongst the 16 to 24s, you see that there's been this sharp decrease in the employment rates in 2010. That was entirely due to the recession. The employment rates of the 25 to 49-year-olds, well, it hasn't changed that much. It's increased a little bit. But the employment rates of the 50 to 64-year-olds and the 65 plus has increased since 1992. So again, a very naive analysis might say, well, we know that life expectancy has been increasing since 1992. And here we have the employment rates of the older workers also increasing. So maybe there is this correlation between being more people in the labor force, more older people in the labor force, and increased life expectancy at older ages. Unfortunately, that's not true, because if we go back to the 1970s, the picture was quite a bit different. So this slide is courtesy of my colleague James Banks, and he's calculated the labor force participation rates of older workers, of men and women aged 50 to 69. And the picture for men shows, the men are the blue lines over here. The women are the red lines, and the green is the average for men and women. So the blue lines show that the labor force participation rate has been declining steadily since the 1970s for men, especially in the 1980s. For 55 to 59-year-olds, it's also been declining. For 60 to 64-year-olds, it's been declining. There's been a rise in the noughties. And also for 65 to 69-year-olds, it's been declining sharply, and then there's a rise in the noughties as well. For women, the picture is very different. Of course, the women's employment rates throughout the period has been increasing steadily since the 1970s. So this very naive correlation between life expectancy and labor force participation rate, it was actually negative in the 1970s and 80s. Yeah. So whatever was driving the increases in life expectancy, it wasn't due to increased labor force participation rates, because life expectancy has been increasing since the 1970s, has been increasing since all throughout the 1900s. So what do we know about older workers? We know quite a few things. I've just picked out a couple over here. We know there are very strong selection pressures because older workers are selected for their good health. That's known as the healthy workers effect. If you have a limiting condition, limiting condition that limits your ability to work, you're very likely to stop working well before statutory retirement age, state pension age. So that means the kinds of people who are in work in their late 50s, in their early 60s, they're much healthier than the general population. There's a very strong selection effect. So we know that the people in work in later life are much healthier than the general population. We also know that despite this strong selection effect, that they're very heterogeneous. The kinds of work that they do are very different, and that's partly because that there's some element of choice involved. So there will be some older workers who are working because they want to work. They really like working. They have good working conditions that they find very enjoyable. And there are some older workers who are almost forced to work because they have to pay off the mortgage, they have debts, they have financial problems, they don't have adequate pensions. So in a sense, they have limited choice there. They have to work for the money. So those kinds of people are the distinction between voluntary, it's not voluntary work, but people who are working because they really enjoy their work, and people who are forced to work. It's very stark at later ages. Of course, there are these groups of people at younger ages, but at younger ages, people work for all kinds of other reasons. But at older ages, the differences between people who like working because of good working conditions and people who are forced to work because they have little financial choice in the matter, that becomes really stark. We also know that most workers aged 65 and over are working part-time. So we can see here that the part-time employment rates, which is the red over here, become around 65% in the 65 to 69-year-olds. So that's much more than those working in a permanent job at that age group. And we also see that the self-employed increase quite a bit. They double in size when they're 65 to 69-year-old compared to when they're 50 to 54-year-olds. So they're working in more part-time jobs that are potentially more insecure because they're self-employed. We also know that older workers get paid less. So this is the average gross hourly wages for older workers, and we can see that there is this decline in their wages, in their hourly wages, as older workers get older. And we also know that although the unemployment rate is really quite low amongst older workers, so that's the unemployment rate amongst the 50 to 54-year-olds, and that's about 5% over there. and amongst the 65 to 69-year-olds, it's about just over 1%. So, the unemployment rate is really low. The long-term unemployment rate, so over here, the long-term unemployment rate is calculated as a percentage of unemployed who are unemployed for at least 1 year or more, is really quite high. So if you're an older worker who's unemployed and you're looking for work, you don't have much chance of finding work. You have a very strong chance of remaining unemployed for at least a year. So what are the theories and concepts behind aging and retirement? And first of all, I just want to explore the concept of retirement a little bit, because it means so many different things to different people, especially in today's context. So the retirement refers to different events and processes. It can mean a total exit from the labor market. So you stop any kind of paid work whatsoever. Or it can mean a more subtle thing, which is ending your main career. So you could still be doing some kinds of part-time jobs which are not related to your main career, but you still classify yourself as retired because you've stopped your main job and you're no longer receiving income or wages from your main job. It could mean that you define yourself as being retired because you're in receipt of pension benefits. You qualify for state pension, so you say, okay, I must be retired now. So you have a group of, well, largely women who have never been employed in the labor force market, and then upon reaching state pension age of 60 or 61, they then declare themselves as retired. So they've never been employed in the labor force, and then they declare themselves retired because they're receiving some kind of state pension benefits. Or it could just mean, their self-reported subjective economic status. So here again, it's this discrepancy between what people say they are. They say in surveys that they're retired, and yet they also tell the survey that they're working. So there is this discrepancy. They feel that they're retired, but they also say that they have a main job. So there are all these discrepancies, and there might have been a time, say in the 70s for men, when all of these events and processes, they occurred at the same time. Around the age of 60 or 65, men might have exited from the labor market and then started receiving pension benefits and ended their main career. But nowadays, that's completely different. So retirement is no longer a single life event, and the current and future cohorts of retirees will look very different to those who retired in the middle of the 20th century. And that's because the routes out of retirement are very heterogeneous. People retire for all kinds of reasons. So the theories around aging, there is a disengagement theory of aging, which says that retirement is a form of natural aging process. So people's loss of their employment roles, it's counterbalanced by their loss of work-related stress and the responsibilities associated with jobs. And this kind of engagement allows people to pursue more rewarding activities, greater time to engage in leisure and physical activity, and can also have more time for health promotion activities. Other theories of aging sort of refer to activity. So if you retire, then you need to compensate that loss of social roles by remaining active in key social roles and replacing those work roles with new roles. So there's also this idea of continuing your earlier identities and activities. Both of these theories, or all of these theories, sort of refer to keeping engaged in later life, in retirement, and finding new social roles to maintain your health and well-being. And here's an example of that. There's quite a lot of evidence now about how voluntary work in retirement is protective for people's health. It reduces the risk of mortality. So this is a forest plot where by a number of studies, these are longitudinal studies that follow up older people who have retired and are looking at to what extent people who say that they're engaging in voluntary work, to what extent that's protective of mortality. So the black line over there is the reference group. That's the people who do not engage in voluntary work. And the dotted line over there is the relative risk of mortality for people who are engaged in voluntary work. And that risk is around 0.8. So that's about a 20% reduction in the risk of mortality for people engaged in voluntary work. So that's quite a strong reduction. So this kind of replacing your work role with a voluntary activity seems to be very protective in later life. So here's a little summary of these theories. There's this idea of use it or lose it. So very often, you might have heard about these brain gym kind of games that are cognitively engaging, and working past state pension age or being engaged in voluntary work is another kind of cognitively stimulating activity. So you either use your brain or you're going to lose your cognitive function. So working past state pension age, working in later life could be good for your health. Definitely it's good for your financial security and independence, and it's good for people's social relationships and networks. What might not be so good is, if you're working in a poor quality job that is stressful, what might not be so good also is people's sense of unfairness. If you feel like, why am I being forced to work to pay off my mortgage and debts when there are other retired people I can see every day? And say, my colleagues, look, they retired, but they don't have to work in this awful job. So that feeling of unfairness can be present as well. And also there's the danger of less physical activity. There's a well-known increase in physical activity when people retire because they've got more time to do gardening, go walking, and so on. So what do existing evidence tell us? And unfortunately, it's a very mixed picture. So my colleague, Katie Matthews, did a systematic review and meta-analysis of all the longitudinal studies on people who work in later life and health. And over here you can see it's really 14 studies show it's good to work in later life. It's good for your health. 17 studies show it's bad for your health, and 5 studies show no effect. When she put all of these studies, well, some of these studies into a meta-analysis, this is the effect of working past state pension, working in later life on depression. So a high score over here, over 0, indicates a higher level of depressive symptoms, and a negative score indicates a lower level of depressive symptoms. It seems like there might be some sort of beneficial effect of working in later life on depressive scores, but it's not significant. That diamond over there crosses 0, so it's not statistically significant. And more importantly, the heterogeneity coefficient, which is 98.5%, is really high. So that's saying that all of these studies that are pooled together are really can't be compared. So this overall effect, what looks like a protective effect, is meaningless because these studies contain too many different kinds of people. I'll come on to what different kinds of people they are. This is another type of analysis that she did, this time looking at poor self-rated health. So people who score high here have higher levels of poor self-rated health. And again, there seems to be some kind of protective effect because the overall effect is negative. So there's working in later life reduces people's poor levels of self-rated health. It's not significant, and the heterogeneity coefficient is really high again. It's almost close to the limit of 100%. Why is it really so heterogeneous? Why are these studies so different? It's because a lot of the studies contain very different samples of people. And one typical example is early retirees. Most of the studies don't distinguish between different kinds of early retirees. There's a group of early retirees who retire because of their health. That's a very strong group. But there's another group of people who voluntarily choose early retirement. And they're very different kinds of people. So as soon as you start mixing these people, treating these people as the same kinds of people, you're going to get a lot of heterogeneity in the results. Both of these groups of people have different levels of baseline health and well-being. And also this kind of analysis, it's not a causal analysis. We don't observe the counterfactual. Let me give you an example of what I mean by that. So this is a very often cited study. It's a very good study. It's based on observational data about what happens to people's poor self-rated health, which is a measure of well-being, as they approach retirement. Retirement is at year 0 over here, and the green line is the overall effect of what happens to people's levels of poor self-rated health as they approach retirement. And you can see that it's sort of increasing, and then upon retirement, 1 year before and after retirement, there's a steep decrease, and then a little bit of an increase post-retirement. And when they stratified this analysis by good working conditions, that's the blue line, and bad working conditions, that's the red line, there was a real big difference. So people's levels of well-being didn't change at all pre and post-retirement if they're working in good working conditions. People's level of well-being were, if they were working in bad working conditions, the red line, was really affected by approaching retirement age. You can see that their well-being scores, their decreased well-being scores increases dramatically upon reaching retirement and then decreases steeply at retirement age. So all of this is based on observational data, but we don't observe the counterfactuals. We don't observe what would have happened to this group of people had they extended their working life, had they continued to work on past the retirement age. And that kind of counterfactual analysis is really critical if you want to estimate an effect of employment or retirement on health and well-being. So there are some ways of estimating these kinds of causal effects. In economics, they're very keen on exploiting quasi-experimental methods. So here's another very cited paper on retirement and health. And it sort of exploits the differences between EU countries in state pension ages. And here, the behavior of retirement, it's not dependent on an individual's health or well-being. It's entirely dependent, well, it's dependent to a great extent upon what is the qualification for state pension age. So it's exogenous. The retirement behavior has nothing to do with the individual's health and well-being, but it's much more to do with sort of structural factors. And here they show that there is a causal effect of retirement and health, but these effects are only temporary. Yeah. What my colleague Katie Matthews was very interested in, it was not the question of retirement on health, but employment on health. So here she's interested in whether if you work in later life, past state pension age, what effect does it have on people's health? And so she used this method called propensity score matching to get at a control group of retired people who are exactly similar to the people who were working in later life. And the kinds of data that she used was the English longitudinal study of aging, which is a cohort of men and women aged 50 years and over. It was started in 2002 with follow-ups every 2 years. It's a representative sample of older adults in the UK. And what she did was calculate the propensity towards being employed in later life. So there are all sorts of things that make a person more likely to be employed in later life, and we can calculate that propensity for people who actually are engaged in later life employment and people who are not engaged in later life employment. And basically, through this propensity score, we can see, well, these people who are green are the people who are actually engaged in later life employment, and people who are in red are the people who are retired, but exactly the same in terms of all the other covariates as the people who are engaged in later life employment. So you've got this control group to do your comparison against. And here's an example of how this can affect the analysis. For age, for example, the unmatched, this is not the propensity, using the propensity score, but we see that the age of the employed group is about 60.65, and the age of the retired group is about 61.3. So it's about 1 year older in the unmatched analysis. But in the matched analysis, the ages of the two groups are entirely the same. If we look at activities or daily living difficulties, it's a measure of functioning, we see that the score for the unmatched group is much lower if you're employed compared to if you're retired. But if you match them using the propensity scores, you get exactly the same levels of limiting health in both groups. So using this method, we find that that there is no overall effect of working past state pension age on health and well-being. She was interested in the effects on depression, on self-rated health, and cognitive functioning. So on the blue bar, we see the unmatched analysis. And looking at this, you might say, oh yes, if you work past state pension age, your rates of poor self-rated health decreases. But that's the unmatched analysis. What you should be looking at is the matched analysis, and there is no effect of working past state pension age for the matched sample. If you look at cognitive functioning, you might look at the unmatched analysis and say, oh, look, there is this overall effect of working past state pension age on your cognitive functioning. But when you match that, when you look at the matched analysis, there is no overall effect because that's not statistically significant. But what about the role of job quality? What about people who are working in good quality jobs versus bad quality jobs? And we know that there's a lot of stress, that's a lot of evidence on the effects of job quality and work stress on people's health and well-being. There's a ton of evidence on work stress affecting people's biological processes. There's also a lot of evidence about how work stress affects people's mental well-being and their sickness absence rates. One of the models of work stress was looking at to what extent people get good rewards for the amount of effort that they put in. So this is a model that asks people how much effort they put into their work based on these kinds of questions, how much reward that they get out of their work based on questions like, do you receive the respect that you deserve from your work colleagues? Do you get enough support in difficult situations? And when we stratify the analysis, when we do the same kind of propensity score matching analysis for the effect of poor quality work versus their retired peers, we actually see a very different picture. Here we see that the people in the red bar, so these are the matched sample, they have higher rates of depression if you're engaged in poor quality work in later life compared to their retired peers. They have higher rates of poor self-rated health, and their cognitive functioning is much worse. It's significantly worse compared to their retired peers. But we don't see any effects of good quality work on compared to retired peers. All of these effects are non-significant. So when we're comparing working in later life in good quality working conditions compared to their retired peers, we see no effects of working in later life on health and well-being. So some very tentative conclusions. Well, the answer is no, we don't find any effects of good work, of work being beneficial in later life for health and well-being, even for the good quality jobs. And if you're working in a bad job, that may actually increase your levels of depression and self-rated health and poor self-rated health. So perhaps you might be wondering, well, we know that bad work is bad for you. So what was the point of doing all of this analysis? It seems very obvious. Bad work is bad for you. What do we learn? Actually, you might want to ask, what's the real question? The real question is, who wants you to work forever? And the answer is these two. Okay, it's not just these two. It's all governments facing a pension crisis. We all know that people are living for longer, that the proportion of people who are qualified for state pension, that proportion is increasing a lot more. So governments are facing a pension crisis, and they want people to work for longer to help solve the pensions crisis. But if they're trying to tell us at the same time, it's good for you, it's good for your health and well-being, I think it's good to be a little bit skeptical of the results. So of that kind of claim. So there are important limitations, of course. These analyses are based on specific cohorts, aged just around retirement age, living in a specific time in England. So any kinds of changes in the employment conditions and retirement conditions can, of course, change these observed associations. And there may be other factors in there that I haven't observed that are causing these associations that I've presented. So my final slide is just to thank the funders of the study, the ESRC, and my center, the ICLS, International Centre for Life Course Studies in Society and Health. My day job is at Manchester, but I'm also an honorary professor here at UCL. Thank you.
Thank you very much, Tarani. One way of staying healthy and in good shape in retirement is to host the lunch hour lectures. But I noticed in a lot of what you're saying, an awful lot of very interesting data here, is the question of the difference between association and causation. However, I'll throw it open to the floor. We need to leave the room at 5 minutes to, so we've time for some questions. So this one here. Can you just hang on for the microphone to arrive?
Hello, I'm Beth Shaw. I just wanted to say that the dip in the 1980s, in your earlier slide, reminds me that at that time there was a big move for people over 50 to make way for younger people. Bearing in mind that those younger people, of which I was one at the time, didn't have student loans, didn't have debts, but there was this idea of investing in the future of young people. And another thing is that you haven't mentioned trade unions at all. And I feel that that has been a big factor in my working life, that I was lucky enough in the 70s and 80s to work places where there were strong trade unions who enforced good conditions and pensions. And I feel that each cohort has to be treated differently. So the cohort of myself, who just retired now, will have a completely different experience of a lifetime of work than the cohort who will retire in 30 years' time, who work such long hours and under such stress.
I completely agree with both of those points. And yes, especially the second point about how the influence and the importance of trade unions in making sure that we work with good working conditions. I do a lot of work with trade unions on work stress and its effects on health and well-being. And yes, it is unfortunate that in today's labor force, many of younger and some of the older people are employed in conditions of work that are less favorable than there was in the 70s and 80s. And that does have an implication for their health and well-being. I completely agree.
Well, I hope that people working longer will see the importance of trade unions, and that trade unions will get stronger, not weaker. Thank you.
The second hand that went up was this one just here.
Sort of adding to that point, when there were no heavy student fees, a lot of retired people could go back into education. And now, according to the figures I've seen from Birkbeck and UCL and things, people are not spending $9,000 a year going back into it. And do you agree that that's an effect? And also, people used to retire to the country, and now they're staying in towns because there's more to do. And also, do you have cross-cultural, I mean, for different countries, and here saying,
Yes, so about the first point on adult learning, so I've also done quite a bit of work on the health and well-being effects of adult learning with other colleagues. And yes, there there does seem to be some health and well-being returns to engaging in adult learning later on in life. So the withdrawal of support for engaging this kind of adult learning because of government cuts, because now cuts have meant that the government has targeted any sort of reduction in fees towards younger people aged up to 25, doing particular kinds of qualifications. So yes, it would, some of the older people's groups that I work with have tried to argue out, we shouldn't be restricting these adult learning courses just to the younger cohorts, because there are also health and well-being benefits that could reduce the financial burden in long term.
No, but I mean, to get a degree now is £9,000. Yes. Before Clegg got his paws on us, there were 3,000, and a lot of people at that stage dropped out. A lot of the people, smoke screen.
You are right. So rather
than just specific training.
There has been this big reduction in older people obtaining degree qualifications in the last few years, and yes, that is part of the very recent government processes.
I'll squeeze in one last quick question from the gentleman at the back there, and that'll be the last.
It's not actually a question, it's a comment. As someone who is well over 65 and still enjoying part-time working, I'd make the comment that my wife, who was incredibly ill this time last year, and I found the ability to continue working during that time an invaluable distraction.
Yes, that's another point I didn't go into, but it's well known from the literature that some people who are experiencing family stress or other kinds of stress really value the opportunity to escape to some extent in work, because it offers support, in a different kind of support that they don't get in family situations. So I'm not saying all work is bad, but only some specific kinds of work is good. Is not so good.
I really must close it now, so thank you very much indeed, Tarani, for a very interesting question.